we are from Medgate today and we have a few questions for you regarding the future of stroke management. So sir, what are the emerging trends in pharmaceutical interventions for stroke prevention?
Prevention. So in prevention, in prevention, there's a treatment and prevention. I presume you know the difference.
Yes.
So in preventing is we don't want the stroke to happen. So the biggest innovation, which is not as yet, which should come in, is to monitor people for their risk factors in terms of control of their lipids, I would say. Well, there's a huge population out there which is not being monitored properly for the lipid fractions and being treated adequately. Although we have good national programs for hypertension, diabetes, and I think the biggest innovation that has already come in is to promote healthy lifestyle, to become fitter. So that is something which is picked up. So the variables have to become more innovative and inform you of your risks, as well as your prediction of having a stroke. So these are the technologies, some of them are already there. You know about wearable watches and wearable Fitbit kind of things which track your activity. So those are, I think, one of the prime things which have really made a difference, but people have to know what they need to do with them. They need to manage their goals, manage their diets. That's the two major things which prevention, and of course, the biggest innovation which should be coming is to how to make people limit their risk factors like smoking, drugs. That's still not there. So those are little things which are still missing in the stroke prevention, I would say.
So sir, when we talk about stroke prevention, sir, what are the most critical risk factors for stroke that are under-recognized by general practitioners?
Like I just mentioned a while back, it's the dyslipidemia, and also the levels at which blood pressure should be maintained. That's my own experience, and that I think is very common to the in general in the medical world. You know, the guidelines have changed, and blood pressure levels have now been reduced, which are considered as normal by the AHA guidelines, as we call it. And this is based on evidence. So nowadays, as contrary to the past, where 140 by 90, for example, was considered to be normal, it is no longer normal. In fact, for the last so many years. So if people still keep not treating blood pressure at levels of 140, 90 or higher, which I'm telling you is rampant. I have everyday people telling me, I have been told that as you grow old, your blood pressure should be higher, which is a myth. It is wrong. You need to control simplest and the most effective risk factor, which is hypertension. Simply treating hypertension can cut down your risk by 50%. So that's one thing. Then again, other risk factors like diabetes, like obesity, they are not being properly addressed. People do not have the right goals, they don't have the right guidance. Diabetes is being treated late, people don't look at the right levels of HbA1c, for example, and those delays can be really costly. And the third one is lipids. I would say these are three from the clinician's point of view, and from the other healthy living lifestyle point of view, you need to, of course, have proper diet and good exercise. That's what's more important.
Thank you, sir.